Dr. Carrie Jones is an internationally recognized speaker, consultant, and educator on the topic of women's health and hormones. She graduated from the National University of Natural Medicine in Portland, Oregon, where she also completed her 2-year residency in women's health, hormones, and endocrinology. Later, she graduated from Grand Canyon University's Master of Public Health program with a goal of doing more international education. She was adjunct faculty for many years, teaching gynecology and advanced endocrinology fertility, and has been the medical director for 2 large integrative clinics in Portland. She's the medical director currently of Precision Analytical Inc., creators of the Dutch hormone test. So welcome.
Thanks.
So I'd love it if you just started us out with talking about, like, what is the Dutch test? How is it run? What does it show us?
Yeah, and it's, as you said earlier, it's a comprehensive test, so Dutch is an acronym. It stands for Dried Urine Test for Comprehensive Hormones. And dried urine is exactly what it is. It's these pieces of filter paper that you will urinate on, kind of like a pregnancy test, and you'll do it 4 times throughout the day. And if you have insomnia, you'll do it a 5th time before, if you wake up at 1 in the morning, you'll do it then as well. And you let everything dry and you mail it back to the lab. And what we get out of it, because it's urine, is we get all the hormones you're expecting. So we get your estrogens, we get your progesterone, we get your testosterone, we get your DHEAS, get cortisol and your cortisol rhythm through the day, your melatonin. But because the urine part also allows us to get these cool things called metabolites, which is basically like where the hormones are going. So you make estrogen, and then where is it going? It has options for when it's going through detox. Some of the options are healthier than others. Some of them cause growth. Some of them can maybe lead to DNA damage, and we don't like that. Same goes for testosterone. Women who are like, I get cystic acne on the jawline, I get the hair growth in places that's not sexy, I'm losing the hair on my head. Like there's a pathway for that. And so we can look and see maybe that pathway's upregulated and we need to, slow it down a little bit and try to get you off that path. And then when it comes to cortisol, like I said, because you're collecting throughout the day, we give you a really great snapshot of your cortisol through the day. So you should be high cortisol in the morning and then gradually go down, down, down so you can fall asleep. But if you can't sleep, maybe your cortisol is high at night before bed. Maybe you're really tired in the afternoon and we can see that your cortisol bottoms out at 3 p.m. and, we need to do something about it. So it's 6 pages of a lot of hormone information to help.
Yeah, that's awesome. Yeah, and I think people with hormone issues, they often feel like they're kind of stuck with it, or it's just genetic, like, oh, I've always had heavy periods, or, I've had hot flashes for so long, like I can't imagine it going away. So yeah, we love it. Do you mind just showing any test and just kind of walking us through the sections?
Absolutely. Let me
too, if I found them.
Let's see here. Oh, you have to let me share screen.
Oh yeah,
and I'll show it.
The new thing.
Zoom's all about security now. It's probably better than what it was.
Okay, should be good.
Okay. Let's see here. Where? All right, hold that thought. Where did I had, of course, I have it. Oh, there it is. I had it pulled up so I could grab it right away, and now I can't find it. Here we go. Okay, can you see that?
Yes, great.
Okay, so this is 6 pages long. So this is the first page. The first page is a summary page, which is just like a snapshot of the important things that you can look at really quickly. So across the top are your estradiol, which is your most potent estrogen, your progesterone, your testosterone, and then the box below that is just a snapshot of your cortisol and your total DHEA production. But when we dive in, the next page are all of your sex hormone markers just listed out, everything that we run with the ranges. Are you above the luteal range, below the luteal range? Are you post-menopausal, what have you? And then, but this is confusing. I mean, this is a lot of like data thrown at you. So we put it in pictures to make it a whole lot easier. And so you can see that in the upper right corner, we have the progesterone. So we look at two forms of progesterone. One is called the alpha form, and then the beta form. The beta form is the most predominant in the human body. The reason we show the alpha form, though, is that it's the form that helps a lot with anxiety and sleep. So if women are not making good progesterone, they're not ovulating, they're perimenopausal, they're menopausal, and she says, "Oh my gosh," and my anxiety's gotten worse and I can't sleep. That's sort of the dial that we look at. Then if we come down, I'll show you the estrogens. We do look at all three. So we look at E1, we look at E2, and we look at E3. So women and men have 3 estrogens. The E2 is the most potent estrogen that we have. And then it goes through phase 1 detoxification, primarily through the liver. So if I'm super cool, let's see if I can draw. Look at this. This, what I'm highlighting, everything in pink, that is your phase 1 detoxification. Your 16, your dial here, this is known as 16. So when you're looking at the report, you read it like a gas gauge. So it's really a dial with an arrow, and in between the stars is the range, and then you'll see this little tiny purple range, and that's the menopausal range. So if you're menopausal, or if you're not menopausal, everything still applies. So in this case, this is really elevated. So the 16 is what causes a lot of, we call it proliferation, growth. It makes things grow. So heavy periods, fibroids, polyps, boobs, like it makes things get, big and fluffy. The next one down is known as 4. The 4OH is the more carcinogenic, more cancer risk, more at risk for DNA damage. We don't like that pathway. And then the last pathway here is known as the 2 pathway, and the 2 pathway is what we call the least carcinogenic. It's the ideal pathway to go down. And then what we do is we shoot across. Your estrogen becomes what's known as a methoxy. And basically, this is actually really protective in the female body. This is actually, they think in research, this is helpful and protective against breast cancer and breast cancer development. And so the goal for a woman is to move all your estrogen down into this pathway. And then after you make this, the next step is to get rid of it. So we are not a stool test company, but phase 3 is when you look at stool testing and make sure that your estrogens can go from your liver into your bile and then out of the system. So it's really nice to look at this and this test and be able to say, okay, here's my estrogen and here's where it's going. Now, the other really important thing, and I mentioned this earlier, is that we do look at your testosterone. So we look at DHEAS, we look at testosterone, and then we look at the downstream markers. And what I was mentioning earlier was if you get cystic acne or hair growth in not sexy places or hair loss, it's this androsterone. It's this known as a 5-alpha pathway, which I know is kind of like a lot and kind of confusing, but it's that pathway. In this example, she's in the red, that causes the acne, the hair growth, the mood swings, the anger, the irritation. It's commonly high in PCOS, but it doesn't have to be. And you don't have to have PCOS, and this might be elevated, such as in this case. So it's really nice to look at this and go, oh, okay, this is what's going on. This is why you're so symptomatic. And then we move on and we look at all the cortisol. And so this is everything we test on cortisol, but then we make it really easy and we put it in pictures for you. So we look at, melatonin. We look at melatonin, and melatonin we collect because it's supposed to start to rise at night as you're getting ready for bed, right? It helps you fall asleep. It's also really important antioxidant, really good for your immune system. Then we look at, again, we have DHEA on this page again, because it is an adrenal hormone and important. And then we look at cortisol. So we look at 3 forms of cortisol to help you understand, why are you stressed? Why are you tired? Why can't you sleep? What's going on with inflammation and infection and lots of other stuff. And so we give you what's known as total cortisol or metabolized. So how much do you make in total? What are you capable? Or are you make a lot like this person? What does it look like when you graph it out? You're supposed to be in the gray shaded area. So you go up in the morning and then down through the rest of the day. And then how much is deactivated? So what I mean by deactivated is cortisol can deactivate itself to cortisone. And if you have a lot of cortisone, then a lot of people say, like, well, I'm really, really tired. And I'll go, oh, it looks like you're just deactivating. You're turning it off as opposed to letting it be free. And this is important to know because some people have a big imbalance. Maybe they have a lot of inflammation or a lot of fatigue or a lot of infection. And so it's really nice to see this so I can sort of tell what's going on with the body. And then the very last thing we look at are some what are known as organic acids. And so we look at a B12 marker. The very first one is a B12 marker known as MMA, methylmalonate. And then we look at two B6 markers, so xanthuronate and kynurenate. Like, who names these things? I have no idea. But
sounds like some alien names.
I know, right? So yeah, so we have B12 is there, then we have B6 is there, then we have glutathione, pyroglutamate, which is the big, just like melatonin, a really big antioxidant in the body. We look at a dopamine metabolite. Dopamine, of course, is our reward, our motivation. When we're dating, it's what gets us all excited and giddy. When our phone pings or a text message pops up, it's the dopamine system that's like, oh, I must check this message. We don't actually test it real dopamine. We test them with like the downstream part of it as it comes out the urine. Same thing, we look at your adrenaline system, so norepinephrine and epinephrine. We look at the downstream metabolite. Melatonin, I said, and then lastly, we look at this super cool marker, and it's basically a DNA damage marker, really helpful for people who have cancer, have a history of cancer, or maybe you've been exposed to something, whether it's a heavy metal or a chemical or a toxicant, and we can see the effect that it's having on your DNA. So we can get some really good information on the Dutch test.
Okay, awesome. I just wondered, is that an actual client result?
It's actually a sample report.
Okay, so it's not
yes,
a real person.
It's not an actual,
Okay.
No, not an actual. I mean, it's very common. The results are very typical for sure, but it's not an actual person.
Okay. Do you want to go over that one and say what you would kind of say to her if you were reviewing her test, or
yes.
should I look for another one?
No, we can. It's a good one because we're gonna scroll up. Okay, so as an example, I
actually wanted to kind of talk about that cortisol pattern on the top page too, because I know that's very revealing.
Oops. Let me clear. And I'll just show you, let's see here, two things. So first of all, I'll show you the progesterone. So in this case, the progesterone is below the star. Mm-hmm. So it tells me she's not ovulating. You have to release an egg to make progesterone. So if I got this test back, I would say, okay, number one, assuming she collected it at the right time of her cycle, number one, you're not ovulating. So we need to get you ovulating so you're making progesterone. And then number two, you can see all of her estrogens are elevated. So she is estrogen dominant because she's making so much estrogen. So she may suffer from PMS, heavy periods, fibroids, endometriosis, mood swings, breast tenderness, all the super awesome things that we women get when it comes to estrogen. Then when I'm looking at her specifically, I'm trying to get my, oh, there we go, my little annotation. So when I look at her specifically, her 16, there's two parts. Her 16 is elevated. Again, that's the one that makes things grow. And this part down here on the lower left corner is sluggish. So this tells me not only is her phase 1 going down the wrong pathway, her phase 2 is slow. And so it's kind of like a plugged up bathtub. My analogy is always a bathtub. So she's got all this water coming in and the drain's clogged. And so what it does is it backflows into the house, into the bathroom. And that's how she feels. She feels this backflow of estrogen. And so what I'm going to do is unplug the drain. I'm going to work on this particular enzyme called COMT. I'm going to work on its big cofactor, believe it or not, is magnesium. But other things are helpful, like B vitamins, methylated B vitamins, choline, methionine, zinc. These are all very helpful to getting this moving. And then on the part over here where it's the 16, this is where we often eat like the brassica family foods, the broccoli, the kale, the cauliflower, the Brussels sprouts. This is where that supplement indole-3-carbinol, I3C, or DIM, diindolylmethane, is really helpful. And the reason diindolylmethane is helpful is it helps to push this pathway, this 2 pathway more. So we'll see the 16 go down and we'll see the 2 start to go up in most cases. But remember, you have to unplug the drain first. So what a lot of women do is they rush to get on DIM. They just go to the store and buy DIM, and then they feel worse. And I'm like, right, because you have a clogged drain and the water continues to overflow. So you have to unclog this part 2 over here, and then DIM will work a whole lot better. Now, in her case, I may also say, do you have digestive issues, gas, bloating, constipation? What's going on? Because I know that is such a big impact on how the body clears out estrogen. So that, and if she's like, yeah, absolutely, I have constipation, I have a lot of gas and bloating, then I would have her do a stool test and then evaluate so we can help her body clear. If you think of my bathtub analogy, like the intestines is the sewer line out of the house. And so I'm like, all right, let's test the sewer line, right? I'm like, let's make sure that's working. And then we'll do the drain, and then we'll do the water, which would be like for DIM. But if we go to cortisol, as you mentioned, yes, so this is a really common pattern. So in her case, oh wait, let me put it more on the screen. Here we go. Okay, so in her case, her total cortisol is high. This tells me she has the ability to make cortisol, or it's borderline high. She has the ability to make cortisol. Why would somebody have a lot of cortisol? Stress, right? Stress, a pandemic, inflammation, infection, obesity. Cortisol can be activated, turned on, amplified in a lot of fat tissue, insulin resistance. And then what happens is the body makes all this cortisol and it has to get rid of it really quickly. So it makes it, gets rid of it, makes it, gets rid of it. And as a result, down below, the free cortisol drops to really, really low. So it doesn't mean she can't make it. It means it doesn't get any chance to stay around. It means it's immediately getting flushed out of the system. So she's making a lot, but nothing gets to stay around. So she's tired for sure. And she's supposed to be the red line that you can't really see because she's so low, but it's like, she's like sort of like dragging, like literally dragging along the lower range. So when I see this, I'm like, okay, the cause is something. The cause is either lots of stress, insulin resistance, you've got some sort of infection or inflammation, and I need to hunt that down. And then the Band-Aid, the treatment is, let's support your cortisol. Let's do things like adaptogens. Let's do things like vitamin C and B5 and all the lifestyle factors such as stress reduction and making sure she's sleeping and, setting boundaries and doing breathing exercises or whatever she needs to do in her life, because I want her stress system to calm down so she's not flushing her free cortisol out so much so she can actually enjoy it. Right now she can't enjoy it. She makes it and flushes it.
So why is she flushing it? Why is the body doing that?
So that's because of the metabolized up here. So that would be the common reasons are stress, high stress, insulin resistance, obesity, infection, inflammation.
So
all of those.
Go ahead.
I was going to say, so in her case, the body is hyperthyroid. Hyperthyroid is another common reason, or if they're on too much thyroid medication. Some people have hypothyroidism, but their doctor likes them to run hyper with their supplements or medication, and that will clear out cortisol very quickly as well.
Okay, so hyperthyroid will clear it. So are you saying like when we make too much, the body kind of senses it's too much and then just tries to reduce it?
Yep.
Okay.
It tries to clear it. It tries to clear it. Yeah.
Okay. Really.
And so as a result, we don't get any of the free cortisol hanging around because it's being made and disposed of very quickly. And so as a result, we don't get a lot of free. And free is what is active, right? The free is like, it's what binds to receptors and turns them on and does the things and gives us energy and helps us with blood sugar and does all that great stuff. But like, let's pretend this person is battling Lyme disease. It's acute flare Lyme disease. And so the body's like, I don't like this Lyme. I'm gonna increase cortisol and I'm gonna work to fight it. And then what happens is the cortisol does its job and then it gets flushed out, so to speak. And so now we have low free cortisol over time.
Very interesting. So on this page is also melatonin, which when I've talked to your lab, they said most of this melatonin is actually made in the gut here.
It is. Yep. Most melatonin is made in the gut. Now, the urine melatonin result also collects what's in the pineal gland.
Okay.
Yes. Yep.
Okay.
We just can't, it's not geotagged though, so I can't tell you like what comes from the gut, right? And what comes from the pineal gland. Yeah.
Okay. So this looks sort of okay, but it's actually, when I've talked to you guys, lower than ideal, right?
20 is kind of like this is the range, and then there's a functional range. So once it gets below 20, then we start to say, look, it's kind of below the functional range. You know, what's going on with their sleep? How are they sleeping? What things like that, which is the big one. When it's elevated, if they're not on supplementation at all, but it's elevated, it could be gut issues. You know, it could be like celiac they didn't know about. We will see melatonin really increase.
Really?
But
Interesting.
Certain foods have high, like cherries and pistachios have high levels of melatonin. And so we'll see melatonin maybe be 300, 400. And I'll say, do you eat pistachios? Do you eat dark cherries? And they're like, yeah, absolutely. And I'm like, well, it's a fake out. It's causing the melatonin result to be elevated.
Okay.
And then if you're on melatonin, if you take the supplement, it will drive it up in the thousands. So this test is best for a baseline melatonin. This is not a good test to monitor, you know, oh, I'm taking 3 milligrams of melatonin. Is that good enough? Because of first pass effect in the liver, it will come through in the urine is thousands. So it doesn't mean you're on too much. It just means your liver is working.
Oh, interesting.
Yeah.
Yeah. And you mentioned it's a big antioxidant. It's important right now in COVID. So, you know, I doubt someone's going to run this test just exclusively for COVID. You probably have fatigue or excitability or heavy periods or cancer in your family or whatever, but we will get some nice insights into how perhaps your hormones may be affecting your immunity. And like you said, with a gut test, you know, we also run a test. I should go put that on sale too. So we run a test that's the GI map, Dutch, and a thyroid kind of all around blood panel. And so it's nice because those things all interact. So sometimes we get the Dutch and I'm like, I really wish I had your stool test. So I appreciate when people run that all at once.
As you talk about and teach, you know, if you have candida, if you have parasites, if you have, you know, just a lot of inflammation because you keep eating foods that you either don't know are bad for you or you know are bad for you and you eat them anyway, that affects the lining of the gut and the immune system in the gut, which then affects cortisol and it affects hormones. You know, it all goes up to the brain to say, hey, there's a lot of inflammation in the gut and the brain has to adjust. Like, okay, well, let's put out a ton of cortisol and help you fight this fight, or let's down-regulate ovulation. Therefore, progesterone goes down. And, you know, now you're low progesterone and maybe higher estrogen, all because of gut. It can all happen because of the gut.
Okay. Yeah. Any other interesting highlights on this particular test?
Yeah, I just wanted to show on the organic acid page, it's a little weird. So the top markers, I was going to show there we go. The B12 and B6 and glutathione markers, when the result is high, so above range, that means the nutritional vitamin is low. So it's backwards of what you think. So if MMA, which is methylmalonate, is high, then you probably have low B12. When xanthuronate and kynurenate are high, like they are in this example, then you probably have low B6. Now, that's the opposite of dopamine and norepinephrine. High means high and low means low.
Yeah, it's
and same with melatonin.
Yeah, and I like to see this because, you know, the B6 and the glutathione are important for detox, and B6 probably is important for hormone. All those B's that seem to be good for hormone production.
Yeah, I mean, and B6 and magnesium are really important to make GABA, and GABA is our calming neurotransmitter. You know, it's our anti-anxiety inhibitory neurotransmitter. So B6 does a whole lot in the body.
So we have right now a little supplement kit called Hormone Care Kit. We're actually kind of renaming it, just be like the Essentials Kit, but it has high dose, powdered magnesium, full spectrum multi with all good Bs, B quality, a good, good absorption. And then we have fish oil. And I just find these things to just keep down inflammation, keep your hormones, detoxing and being produced.
Yep.
So if
help
you
those mitochondria.
yeah, I wanted to talk about it too. So if you're only doing a few things, that's why I sort of make it our base kit. It just covers a lot of bases. So yeah, I saw a little video of yours on Instagram, or was that where you were talking about how hormones are made in the cells and the mitochondria, and I'm like, how have I never connected these dots before? Because I'm so into mitochondria and cellular health. So I'd love to hear more about that.
Yeah, I think on the Instagram I put, so the production of cortisol starts and ends in the mitochondria. And actually let's see here.
You might have that graphic or something.
I'm like, let me pull that graphic up because it's way easier to see.
I'll kill some time while you do it. Megan was also asking if a patient is already on methylation and adrenal support and taking Bs, melatonin, glutathione, do they stop those supplements before testing, or can a test be used to see how it's going with those supplements?
So it depends on you. It depends if you want to see you on them, stay on them, except for melatonin. Melatonin is the only caveat. That one you do have to, it is a baseline. So you would have to stop melatonin for a couple days to get it out of your system and do the Dutch test. But if you can't sleep without melatonin and that's more important to you, then stay on the melatonin. Just know the melatonin result will not be useful at all. It'll be in the thousands and it doesn't mean anything. So we do have people who it's more important them to sleep. They take their melatonin. They don't care about their baseline melatonin. And then we're just like, look, it's going to be in the thousands. Everything else, though, it's up to you. If you want to be baseline everything, you will have to stop it, though, for several weeks.
Yeah, that's why we don't usually recommend it.
Yeah.
We're just except for the exact hormones how you describe on the kit.
Yeah.
Because there's so much overthinking that can happen. And it's just just stay on what you're on. We'll see if it's working or not. And that's fine. So RB, I think that kind of answered your question too. Terry was asking if you need to unplug the drain and don't tolerate magnesium or some B vitamins, what could you do?
You can do so what you can do is Google Methionine Cycle. And there are so many cofactors in the methionine cycle that you just pick a different one. So you can do choline, you can do methionine, right?
Okay.
Zinc.
Okay.
So when you look at the methionine cycle, our methionine cycle is where we go from homocysteine, which a lot of people are familiar with. Homocysteine, so in my head, homocysteine is on the bottom, and then it comes around and then makes methionine, and then methionine makes what's known as SAM, or a lot of us are familiar with the supplement SAMe for mood. So SAM, the M in SAM is a methyl donor, and it's the M that goes over to that end to the estrogen and neutralizes it. And so SAMe is the other cofactor. So if you can't do magnesium, zinc is a research study I read said that zinc was like an 80% good enough replacement for magnesium. Just be careful, zinc can make you nauseous on an empty stomach. But zinc is a pretty decent replacement. And then you could consider like SAMe, or just look at that image and see what all the other nutrients and cofactors that are required.
Really interesting. I love that. Zinc is good for making progesterone, reducing acne too, right? I do well with it in a multi. If you try to give it to me on its own, no good. So we just make sure that our multi, and we're coming out with our own multi soon, just has a robust amount of zinc, and then your bases are usually covered. Just take it with a meal.
So this is my mitochondria slide. This is for a lecture I did in men's health, but it applies to women as well. So here is your mitochondria. And so what happens, or this is your cell, I apologize. So this is your cell. And then what happens is the first step, this green thing down here is your mitochondria. But the first step in all of your sex hormones and all of your cortisol production is the star protein binds to cholesterol. That's the first step always. And then it moves into the mitochondria and it forms pregnenolone. Pregnenolone is the first step always, but you can't just give pregnenolone and expect all your hormones to increase, because cholesterol and the star protein are the first step. It's the rate limiting step. We have to do that step first, and then it forms pregnenolone. Then what happens is pregnenolone floats over to this orange blob, which is your endoplasmic reticulum, and it forms testosterone, and then it can turn into estradiol. But pregnenolone can also, which is not shown on this slide, it can also go a different way. It can make what's known as 11-deoxycortisol, and then 11-deoxycortisol floats back over to the mitochondria, becomes cortisol, and goes out into the system. So your cortisol starts and ends in the mitochondria, but all of your hormones, progesterone, testosterone, estradiol, estrone, all start in the mitochondria. They start as the star protein bind to cholesterol, then to pregnenolone, and then move out. So you can't just force pregnenolone into the endoplasmic reticulum and hope for the best. The endoplasmic reticulum's like, no, that's not how it works.
So is this a certain kind of cell, like an adrenal cell, or could it be anywhere in the body?
Every cell, it's different, right? So if you are the theca cell in the ovary, then you're going to make testosterone, and then your testosterone is going to go to the granulosa cell, and it's going to make estradiol. It's going to convert into estradiol. If you are a adrenal cell, then all of this happens right in the same cell. You make cholesterol to pregnenolone, and then come back again as what's known as 11-deoxycortisol, and that converts into cortisol. So it really depends.
Okay, I'm definitely going to go back and watch this.
And remember, these cells are the creation of these hormones are by different master hormones. So if you want to make cortisol, FSH is not going to make cortisol, right? You need ACTH. But if you need to make estrogen, that's where you want FSH. So in this example, so this is men's health. So in this example, LH is the activator. LH is what makes testosterone in men. And so LH is what's like, hey, testicular cell, Leydig cell, make testosterone. So it does.
Okay.
But in women, LH makes progesterone. LH would tell our lutein cells in our ovaries to make progesterone.
Okay, interesting.
Yeah, so it's all different signaling. So it's different signaling, but it's always in the mitochondria and the endoplasmic reticulum.
Interesting. Yeah, I'm going to actually make a few clips of this thing for Instagram and go watch them again too, because it's funny, Carrie, just an aside, I went through mold for a long time undiagnosed, and my hormone levels were so low. And I think I may have even talked to you about one of my first Dutch tests. I don't know if it was my first or my second, and you're like, oh, your thyroid looks off, go check it. But always low, and practitioners, this is something that I'm like kind of against. Oh, you're too stressed, blah, blah, blah. Stress, it's all your fault. And now I really understand a few of the different mechanisms where mold inhibits hormone production. And I'm like so thankful I understand that now. So here's one mechanism. Mitochondria are pretty much effed if you have mold. Yeah. That's one thing. Yeah. Your brain's inflamed, so the signaling there with your hypothalamus, pituitary, everything's kind of off. Right. Everything's inflamed up there. And then third, there's actually like a compound that enters the HPA. I forget the compound name, but some compound from mold, and it's just like toxic to those key cells. So, just top down, you're in trouble.
And it's protective. It's when I talk to practitioners, not the mold is not protective. The action is protective.
Yeah,
right. So the body's like, I'm getting attacked. This thing is brain on fire. This cell itself is not healthy because of the mold. And as women, we are designed to reproduce, whether we want to or not. Don't care. But we go. The cycle is like what makes us who we are. And so the brain's always scanning for threats, and it's like, this is a threat. I'm not going to make her cycles normal. I'm not going to give her healthy levels of hormones, right? I'm not going to ovulate when I'm supposed to ovulate. And so it's it's the hormones drop, it's the mold's fault, but the brain is like, now is not the time to probably make a baby. So let's protect resources. Let's protect resources.
That's another good point too. Yeah, it's there's a reason for it. You need to just be sleeping and whatnot. But I think to me, it's always so helpful to like understand these processes, because then you can go and reverse them. Like another thing I've learned about mold is like, you can't just attack the toxin. You had this great slide about all the things that help mitochondria. It really has to be pretty multifaceted to recover. And when your hormones are so tanked out, and that was probably one of the most dominant symptoms that lasted for me for so long, breakthrough bleeding and low sex drive and all that. And like, it's no way to live. So, and now there's hopefully one more root cause people can know about why hormones are low. So really,
and right now with the pandemic and all the stress of the world, I have a lot of women, and I'm sure you do too, that are like, I skipped a period. My periods were awful. I didn't ovulate this month. Why? What did I do wrong? Like, you didn't do anything wrong. Again, the brain is constantly scanning for threats, and because we're in a pandemic and the world is falling apart, that is the body's like, ooh, this is not a good time to get pregnant. Like last month, the month of May, I didn't ovulate, which is super rare for me, and I was like, oh dang, this is getting to me because I didn't ovulate. But I've had, and I posted it on, social media, and I had so many women comment, go, oh my gosh, I thought something was wrong with me. I'm like, nope, you're reacting normally. It's a protective mechanism that's reacting normally to the world around you.
Yeah, I've also seen, and I used to, be in clinic, and people were in a car accident a couple months later. My period didn't come. My period's coming every 2 weeks. I'm like, yeah, this is what happens. Doesn't seem to happen immediately, but then it starts to happen. We had a couple other good questions here. DM asked, how do vagus nerve tone and hormones interact, especially with respect to, I think this is hot flashes?
Yeah. So the vagus nerve, as you guys know, goes from the most of it's up to the brain. Most of the communication is upwards. And so if there's stuff going on in the gut, then it's a direct connection to the brain and can affect hormones, particularly cortisol. It has a really big influence on cortisol, but it can influence other, like, do you ovulate, how you make estrogen, men, how they make testosterone. Yeah, the vagus nerve can really affect that, because remember, all the signaling comes from the brain. Our ACTH, our FSH, our LH, all that comes from the pituitary down. And so if the vagus nerve is like, this is not good, then the brain's going to be like, all right, got it. This is not good. Let's not mess up, let's protect. And it will affect the hormones.
Interesting. So that could be, again, mold, infection, trauma. Any things you particularly like to try to reverse that?
For all the vagal nerve
like any exercises.
So I'm like sing and hum and end your showers in cold water and lay on your right side and meditate and yoga, and I wash my face in cold water, all of those.
Whoops, you're pretty frozen, so we're just going to wait a minute for it to come back. Uh-oh, now we lost her all the way. She'll probably come back in. And then Paula, I'll get your question in, and then we might kind of wrap up. Oh wait, and I also see a question from Christina. So Christina, I'll kind of answer your question in the meantime. Yeah, fibroids post-menopause. Estrogen can still be high post-menopause. It's interesting. There's usually like a conversion issue. Usually high estrogen is involved in fibroids. There's a great book by Dr. Alan Warshawski that you can look up about fibroids, and I actually interviewed him a long time ago, so it's on our blog as well. Hormone replacement may be more on the lines of like progesterone to balance it out, but also doing some of that estrogen detox like we talked about earlier. Castor oil packs could be really helpful. Looking into seed cycling could be good. So there's an excess and you need to shrink it. But yeah, I would look up Alan Warshawski. I know it's kind of a hard name, in our blog, or just look up fibroids and you can listen to his interview and maybe find his book. And the zinc and testosterone, Paula, I think that zinc will sort of tamp down the angry testosterone, so it's good for like acne. So I don't know if it boosts testosterone or if it just sort of balances and cleanses it. Maybe I'll look that up since she's not back yet. I love, if you want to boost testosterone, I love our Libido Stim F. It's herbs and a little DHEA, and it works like a charm to boost testosterone. 2-3 weeks, you're gonna have more sex drive, feel more vibrant, have more muscle mass. So that product's in our shop. I really wish more people would buy it because it's like it's a lifesaver for me. I don't even do it all the time, but I kind of will cycle with it. Magnesium and zinc both increase free testosterone, I'm seeing here online. Let's tell you. So there's also some herbs like horny goat weed. That's good. Vitamin D, saying it's good. Tribulus, I think that's in our formula. Fenugreek, ginger, that's an easy one. DHEA, I mentioned before. We do a really low dose one. Probably good to get a hormone test like this so you can know, like, you don't, you're not at risk of getting too much hormone, but ours is pretty low dose. This is saying 100 milligrams is the daily dose. Ours is only 3. So, it's low, just a little bit of a boost. Ashwagandha and zinc. Let's see if they say how many milligrams. Good for recovering from high intensity exercise. Good for sperm count when it's low. That's about all I'm seeing. Oh, I might have to let her back in, huh? I don't see her though. She's missing. Hi, Rosemary, Rebecca, Paul, Lee, Liberta. Oh, I think she's having a problem. Oh, you read Warshawski's book. Good for you. I don't know if you can have to necessarily avoid progesterone. Yeah, so there's a difference between urine testing and serum testing. I really prefer the urine testing. The blood testing can be very accurate for that like snapshot of what you see. Sometimes you do it day 3 of your cycle or day 21. So still can be helpful, but you're missing all those metabolites and how you break down estrogen. So for someone like you, Christina, this Dutch would be fantastic to see what's really happening with your hormones and then respond accordingly. A lot of people in my community aren't comfortable to take any hormones. So I have to just kind of work with that. But everything we sell hormone-wise is super low dose. So it's usually not going to be like a problem. But yeah, the blood testing is a little different, pretty accurate, but also just kind of like a snapshot of where you are that day and just missing some information. And then Christine asked, she has rheumatoid arthritis and joint pain. getting worse before your period? What is happening? Great question. Do hormones irritate the immune system? What can I do about it? So a few things, Christine. One thing you might want to keep in mind that can get worse when things get worse before your period is Lyme disease. But then there's usually also rotating pain at other points of the body. So maybe something you want to look into. Aside from that, when you get close to your period, there's a lot of hormones you're detoxing, right? Everything's dropping. So if your liver isn't up for that, it's already overloaded, you're not going to detox well, and you might get that extra inflammation. And if you don't have a lot of progesterone in the second half of your cycle, that can also irritate things, insomnia, pain, leg cramps. So you may want some progesterone. And really, this is a really great place for magnesium if you tolerate it. Take it every month like we do in our Hormone Care Kit. It just kind of smooths out that process, so it's not so like upsy-downsy. So when I'm really consistent with that stuff, my moods, my periods, it's all better. It's tricky because you got to be consistent, and like mid-cycle you might not really be thinking about your period, but I would encourage you to just try like our Hormone Care Kit for just a solid month and see if even in just 1 month you're doing better. So I didn't post, let me post real quick and show you guys a couple things. Here's the Dutch test kit. So it is $50 off right now. And then I just put the link in the notes, and then let me show you the Hormone Care Kit, which is, we'll probably keep going, but we'll also do a very similar kit that we're gonna call like Daily Essentials. I just think everyone really should take them, like whether it's for your hormones or not. So let me screen share and show you that. So we're going to be talking a lot more about this soon, doing subscription for it, that kind of a thing. So we actually have some pretty cool stuff coming up that when you subscribe, you'll get coaching calls with me and discounts and stuff like that. So here's the Hormone Care Kit. It's a liquid fish oil, powdered magnesium, and a 1-a-day multi. And then we'll come out with a very similar other kit soon. You just take 1 dose on the bottle every day. And then this is the Dutch test. Frankly, it's a pretty fantastic deal at $3.95 to get the whole test and the consultation. If you go to the Dutch website and compare, you'll see that like the price is very good. They charge about the same just for the test. And you can see the test is not easy, and the supplements she's recommending aren't like obvious. So it's really nice to work with us, and our coach Nikki does most of those consultations. So all on our shop site, which is hormonedetoxshop.com. Dutch on sale. What's today? I'm not sure if we'll leave it through the weekend or through the rest of the month. But if you're interested, just go get it. Just go get it. Okay, let me see if there's any last questions. I don't think so. Well, thanks so much for being on, guys. That was some good questions and lively discussions. You know, Carrie's amazing. We've got other old lectures by her on our YouTube channel. Everything we do is on our YouTube channel. I just interviewed Dr. Anna Kabeka on Tuesday about menopause and, menopause and weight loss. It was fantastic. I'm actually gonna put her link in the notes here. So if you ever missed one, nobody was really on the one with Anna. So this is if you're working with, you know, weight gain, brain fog especially during menopause, it's a fantastic diet. Or if you just got some stubborn weight you want to lose, I'm a big fan of her work. And yes, Karen, the Dutch test is still great if you're in menopause. You still make hormones, right? And sometimes they're doing something goofy. So you definitely want to see what they're doing. I really love the big 3 too, that we also offer. Let me see if I can, hold on a second.
name's Bridgit, and welcome to.
One sec. So we have this whole expert series link I want to share with you, where all the old recordings are. And then let me just show you one more thing and we'll wrap up. So do we need to zero in on our ovulation timing for the test? Yeah, if you're still cycling, you do. Unless you want to run a different test that you have to special order from us called cycle mapping. If you feel like, I don't know what my period's doing, it tests it more like 10 days a month. But otherwise, yeah, you want to, if you have, again, if usually we're ovulating around day 14, if you have a really long cycle, you don't know, you can actually run urine test strips for ovulation to see when you ovulate. You can get them, online. That's one option. Or you could just do it on day 21 and be like, I don't know if I ovulated or not, because then we'll know from the test. If you're postmenopausal, you can do it any day you want. If you're a man, you can do it any day you want. Okay, so I put those two YouTube links up there. And then I was just going to show you one last thing, which is, so Carrie just said her internet is down, so I'll just let that go. So our big 3 test isn't listed on sale right now, but I think I'm going to ask our manager to change that because it's a great test for kind of including a lot of these elements we talked about. Is the thyroid doing something screwy? Is blood sugar off? Is vitamin D low? How is the gut working? So when we put this on sale, it's $150 off. So I may go ahead and do that. When will Dr. Kerry be back? I'm not totally sure. If we do another hormone month, we might have her back. To be honest, testing isn't real popular right now because of COVID. So if that starts to pick up, we'll be putting more emphasis again on testing. I still really believe in testing. I love Dr. Kerry's info. We're having Kieran Christian come on next week talking about, the Megaspore products again. So we love to interview experts and yeah, just kind of changing our emphasis a bit as people are being more conscious of their budget and but we're still talking about our labs. So good. Yeah, she's fantastic. So maybe we'll have her back early fall or something like that. Well, thanks so much for being on, everyone. I appreciate it. And I will be back next Thursday with somebody. I can't remember who. Bye, everyone.